Hi, good evening, everyone. My name is Andrea, and the topic that I chose to speak on for my persuasive speech is healthcare and why it's important that everyone have access to healthcare. I'd like to just start out by giving you a few facts. According to the London Department of Health, racism and inequality for African Americans still is playing a big role in why many African Americans don't have health coverage. And also, according to the London Department of Health, people with disabilities tend to not have adequate coverage or coverage at all. And some of those contributing factors for that could be that perhaps a difficulty relaying the needs to their doctor or provider and what they need. So that's still a work in progress. Also, according to the New York Academy of Science, children with Medicaid tend to be in better health than children that don't have any medical coverage at all. And also, pregnant women, according also to the New York Academy of Sciences, also tend to be in better health and receive better prenatal care than women that don't have any coverage at all. And I just think that's extremely important, because if you've known someone that's pregnant or been pregnant, or you've been in a situation where you didn't have medical coverage, or maybe the job you were at didn't offer that, it can put a lot of stress on you or your family with getting the health care that you need. That hits close to home to me because I work in the medical field, and sometimes a lot of people that I'm assisting on a daily basis, they're running into that problem. I need something done but can't get it done because they either can't afford health insurance or the premium each month, or their job doesn't offer it. So as a country, we're still working towards these things to fight for everyone to have health care. And also, it's been according to the Century Foundation, some things that contribute to why many Americans don't have health coverage could be lack of transportation, or the coverage that they need, or the service that they need a doctor to provide isn't provided at a location near them. So that's still a constant struggle and a battle that we're fighting as a whole with this country, as to get everyone on board to help with this situation. Some good news is, after the Affordable Health Care Act was implemented, the amount of African Americans that didn't have coverage, it did go down by 20%. So that law going into effect did help a lot of people in the African American community, and helped a lot of Americans in general. Now you may be asking, well, what can I do as a person, just me, to help with this crisis? As one person, there may not be much you can do, but as a whole, there's some examples of things we could do. For example, considering who we're voting for, the politicians, et cetera, things like that. How important is healthcare to them? It's really important, to pay attention to these things that could affect you or your children or family members, grandparents, and also the Medicaid eligibility requirements. It's been proposed maybe loosening the requirements, the income requirements. Possibly, if you make more money, you could still qualify for coverage. So in conclusion, I would just like to say that if you or someone is going through this struggle, you're not alone in it, and there's things that we can try to do. You could also ask certain providers, is there like a sliding scale, or is there a certain portion you could pay towards certain services out of pocket, or maybe payment plans that could also assist people that do not have coverage. I hope this information was informative to you and helpful to you. And I hope you think about what I said. And my goal, hopefully, is that I can reach somebody and they can also see how important this is to me. And free healthcare coverage, or affordable healthcare coverage for everyone, to me, would be ideal. And I thank you for your time.